Okay, let's begin. So for the members of the press present today, welcome. My name is Diana Chan McNally. I come from the Toronto Drop-In Network, and I will be moderating today's event. So on February 10th, the Toronto Drop-In Network released a letter alongside 48 organizations entitled Demands for Immediate Action to Address COVID-related Risks and Harms for People Experiencing Homelessness, which commanded action from all three levels of government. Following the letter's release, none acted. Instead, shelter outbreaks increased, a collective 302 cases, including at least 43 variants of concern across 20 outbreaks in just 2 months, and supports continued to be grossly inadequate and deeply unsafe for people experiencing homelessness. Because of this inaction, 56 organizations have now signed on to the letter, which has been expanded upon as of March 9th, and are present today in solidarity with its demands. Those calling for change go beyond activist groups. We are supportive housing providers, respite providers, drop-in and homeless outreach service providers, health professionals, labor unions representing frontline homelessness service workers, community centers, academic and research organizations, and faith organizations. To begin, we will hear from Susan Bender, manager of the Toronto Drop-In Network. Susan?
Hi, and welcome everybody. So 1 year ago today, the WHO declared the pandemic. 1 full year. So how is it that people who are homeless are still facing so much risk? The funding the provincial government announced yesterday for municipalities is an acknowledgement of the risk and dangers faced by people who are homeless.
Well, would there be a better place for us to meet? Maybe in the back?
And it does not provide the resources needed to adequately respond to the situation or to lay the groundwork for a just recovery. As advocates, workers, and people experiencing homelessness, we feel it is critical to highlight the failures of governments at all levels to respond to the causes of growing homelessness or the multiple risks faced by people who are homeless in this city. Failures that have led to the urgent situation we are in now. The vaccine rollout is only part of what is needed to ensure the health and safety of people who are homeless and the people who work with them. Our speakers today come from across all of the city of Toronto. They come from across the paid and voluntary sector, from faith communities, and from lived experience. We all agree that immediate action is needed to address the sudden steep increase in COVID-19 positive cases among shelters, as well as in the broader community of people experiencing homelessness. We want to hold each level of government accountable for what they must do to save lives and to do more than that, to ensure the safety and dignity of people who are experiencing homelessness, to support the capacity of current services to both address and contain further infection, and looking towards a recovery to actually build the social and physical infrastructure that has been needed for so long, so that this kind of emergency situation does not happen again. The letter that has been signed by 56 organizations and sent to all our government reps identifies concrete steps that need to be taken by all levels of government. Our speakers are going to demonstrate the need for these concrete steps, not only for right now, but also for a recovery that addresses the endemic issues that have been so magnified by the pandemic. We are all in this together has not been true for thousands of people in this city, and it will not be true now unless decision makers listen and take action.
Thank you, Susan. Next, we're going to hear from Dr. Naheed Dosani, palliative care physician and a health justice activist.
Thank you so much. And thank you, Susan and Diana, for that kind introduction. It's an honor to be here today and to join over 56 organizations across the city and numerous colleagues who work on the front lines of the homelessness crisis. It goes without saying that people experiencing homelessness have worse health outcomes in our society. Before the pandemic, this population was 28 times more likely to have hepatitis C, 5 times more likely to have heart disease, and 4 times more likely to have cancer. We know that life expectancies for people experiencing homelessness in Canada are half of what they are typically for those who are housed. Literally, people who experience homelessness typically live, if they've had life on the streets and lived life on the streets for several years, up until an age of approximately 34 to 47 years old. And then the COVID-19 pandemic happened. What we saw was that people were hanging by a thread before the pandemic, and that thread has actually snapped. People are more disconnected from their health and social supports. Respites and shelters and drop-ins have done the absolute best that they could to stay open and support people, but because of physical distancing requirements, people are more disconnected from their health than ever before. We know that this pandemic and virus is not an equal opportunity virus. It impacts people experiencing homelessness in a more significant way. People who experience homelessness are 2.4 times more likely to test positive for COVID-19, 20 times more likely to be hospitalized, 10 times more likely to be in ICU, and 5 times more likely to die from the COVID-19 virus. Across Canada, in cities like Toronto, we have seen encampments, people living in tents and other communities. We have seen these communities grow in size. They're lining the cities across Canada. And I have personally witnessed how this pandemic has played out for people who live life on the streets, for people who don't have homes, for people who don't have the social supports and security to get them through this pandemic. COVID is a public health crisis, but homelessness is a public health crisis too. We are in a public health emergency. We demand change, and we demand change now. The lives of those we support and care for truly depend on it. We may have all weathered the same storm, but we are not in the same boat. Some were in yachts thriving, others in rafts barely surviving. Inequity is the heartbeat of injustice. Thank you, and we look forward to demanding change and seeing change in our communities.
Thank you so much, Naheed. Next, we will hear from the Reverend Andrew Asbil, the Bishop of Toronto from the Anglican Diocese of Toronto. Thank you.
Good morning. It's very good to be here. Anniversaries are very important. Some fill us with gratitude, while others are somber and challenging. We express both today. It's been 1 year of living with COVID-19, and on the one hand, we are grateful for leaders at all levels of government and in our communities who are working hard to support us all in these extraordinary times. And yet, on the other hand, we also recognize the profound loss of life, our collective grief, and our alarm that there are many in our society who have slipped through the cracks and who live perilous lives on the edge, particularly those who are homeless. And on their behalf, we demand change now. 22 years ago, the Federation of Canadian Municipalities declared homelessness as a national emergency. And 22 years later, it is a greater emergency than ever. Even before the pandemic, thousands of people in our city and surrounding communities were homeless, and many more were vulnerable to losing the housing they had in an increasingly unaffordable housing market. In pandemic, we see more people relying on shelters, warming centers, hotel rooms, and encampments, not only for shelter, but for safety from the spread of COVID. Tens of thousands more are at risk of eviction due to interruptions in income and changes to the landlord-tenant law that make it easier to evict tenants who have fallen behind on their rent. And we are living in pandemic and in a housing crisis. The housing crisis is a human rights crisis. It is a reconciliation crisis. It is a public health and moral and ethical crisis. Human rights. The international law has long recognized that adequate housing is a fundamental human right. This right is explicitly articulated in the Canadian National Housing Strategy Act. What we need now is for that right to be realized through policies and programs at every level of government. Reconciliation. Today, a disproportionate number of people experiencing homelessness in Toronto are of Indigenous descent. A commitment to reconciliation and right relationship with Indigenous peoples needs to include an explicit focus on housing. Public health. Housing helps provide people with dignity and stability and is a key determinant of mental and physical health. And as we have seen, it is a crucial element of halting the spread of COVID-19. Moral and ethical. Our shared humanity demands that we treat others with respect for their inherent rights and dignity. To love our neighbor as ourselves. Our own faith tradition envisions a society in which those who have much do not have too much, and those who have little do not have too little. A society in which each person is secure in their own dwelling place. No one is left behind. The Anglican Diocese of Toronto has a long history of advocacy on housing issues and a long history of reaching out to meet immediate needs in our communities. We know that the housing crisis has been building over decades. While we continue to advocate for long-term solutions in permanent housing, we also call for the immediate measures that would help support the most vulnerable so that no one gets left behind. Thank you.
Thank you so much, Reverend Andrew. Next, we are going to hear from Victor Willis, who is the Executive Director of the Parkdale Activity Recreation Center, or PARC.
Good morning. Thank you, Diana, and to the previous speakers. Housing is a human right, as was just previously stated, and therefore all levels of government need to protect and make housing available and accessible to all Canadians, meaning affordable based on income. Housing for the lowest income and most vulnerable requires serious investment. Between 2011 and 2016, Canada lost 350 units of affordable housing. These were one-bedroom apartments with rents at or below $750 a month. I suspect that the numbers will be similar or even worse between 2016 and 2021. From 1970 to 2019, Canada's population increased by 16 million, or almost doubled. Ontario is similar, but affordable housing investments have not kept pace. Between 74 and 86, 253,000 affordable units were created through a national housing program. That was almost 109,000 in Ontario. The investment slowed over the next decade and stopped federally in 1993 and in Ontario in 1995. We have a national housing strategy that's been announced, and over the next 10 years, the goal is 100,000 units. In Toronto, this means that as of 2020, 81,664 households are waiting for affordable housing. For people vulnerable with mental health concerns, there are 22,000 on the supportive housing wait list. The city has laudably identified creating 18,000 supportive units over the next 10 years. But the current math of population growth suggests that that target will fall short. I asked 3 experts in the area of housing what we need at the federal, provincial, and city level. I'll focus on their responses federally. Housing is a human right, fundamental to dignity, health, and life. Everyone in Canada has a right to a home that is affordable, safe, accessible, and secure. All levels of government have a duty to uphold that right using the maximum available resources availing themselves of all powers within their jurisdiction and giving priority to those in need. It has been a generation since there was a plan and program for housing Canadians. The federal government needs to continue its investments in affordable housing. And the province needs to similarly follow that investment and continue the kinds of increases in housing that we so, I think, tragically understand are necessary. We demand these increases in housing. We demand that people live securely, are able to afford a place to live, and have dignity. This is what needs to be done at the federal, provincial, and city levels in order to make homelessness a thing of the past. Thank you.
Thank you so much, Victor. Unfortunately, Charmini Fernando, the Executive Director of Cy Woolner, is not able to join us today. So next we will hear from Miriam Frausto, a frontline worker at Sistering's 24-hour drop-in center.
Hi, good morning, everyone. My name is Miriam Frausto, and I'm a frontline worker at Sistering. We have a respite bedding program at the moment. I've been there for over 7 years. Our current location, we're at 962 Bloor Street West. I am extremely honored to speak up today, to take this opportunity to represent all frontline workers, and as I call them many times, my colleagues. We are in a race with COVID-19 and the variants, and our government with COVID-19, and it has brought us a high level of uncertainty, and we need all levels of government that they must do better. We have learned and made many changes in how we engage with one another. As a frontline worker and working with the most vulnerable communities in the shelter system during these times, it has brought a large scale and various challenges to myself and to all my colleagues and frontline workers. The challenges of emotional stress, a degree of anxiety in terms of all and my own mental health. There's also an increase and an impact in our lives because from our regular work duties or daily routine, we also have COVID added. It's an added load daily. Also, to fear the spread of COVID-19 variants to our family members and feeling every day the burned out, traumatic stress, the anxiety, and at times very depressive symptoms. We have somehow overcome the first and the second wave of this pandemic, but now the third wave is now promptly arriving, and the long-term implications will likely increase a rate of psychological problems, and these factors must be addressed immediately by all levels of government. So we're demanding right now for all levels of government to step it up. And number one, to legislate our paid sick days and to reinstate our $4 wage top-up, our provincial pandemic pay for all essential workers. And to invest highly in my own and all of my colleagues and frontline workers' mental health support, including the grief of loss support. Current protocols and supports are not working, but only putting barriers and leaving room for errors, confusion, and many unsafe situations for our clients and for ourselves, for the frontline workers. And in closing, I would like to leave you with this. The city says to us that we must measure to success of all our services. And I ask myself, how can we accomplish that if the province will not provide the proper tools, the support, or the financial funding for any levels of government, so that we can continue to help our communities and to put an end to this pandemic. So we are asking for this change and for this demand, and we need it now. Thank you.
Thank you so much, Miriam. I really appreciate your words. Next, we're going to hear from Melissa Ban, who's the Interim Executive Director of Progress Toronto. Miriam, or Melissa, please.
Thanks. Progress Toronto is honored to join advocates working on the front lines today, calling for immediate action from all levels of government to support people experiencing homelessness and the workers that are on the front lines and all the advocates that are on the front lines to support people experiencing homelessness. We are nowhere near out of the woods from this pandemic. There is a third wave of COVID-19 on the horizon with unpredictable variants, a shelter system under extreme pressure and at capacity. There are unprecedented number of people living outside or in encampments. Yet on March 8th, just last week, the province began enforcing evictions in Toronto and other parts of the province while the pandemic rages on. During the second wave in January alone, while the eviction freeze was in place, the Landlord and Tenant Board conducted 1,431 eviction hearings. Those evictions will be enforced and thousands will lose their homes. We know evictions spread COVID and kill people. We need to stop people from becoming homeless in the first place. The province must enact a complete moratorium on all residential evictions for the duration of the pandemic. This includes prohibiting eviction on the basis of unpaid rent for the pandemic period, and full relief for those who have been unable to pay rent in full during the crisis. Lastly, the province must commit to ensuring that supportive housing is funded in Toronto. For the thousands in our city experiencing chronic homelessness, it's not enough to provide an affordable space. Services to support those experiencing homelessness, like harm reduction services and mental health supports, are key to maintaining people housed. The provincial government needs to urgently fund those services at the scale that is needed now. We are calling for funding to ensure that the City of Toronto can meet its goals to activate 1,098 affordable supportive homes in 2021. 48 million in annual ongoing funding to create and maintain 2,000 new supportive housing units annually. We will continue to fight with our allies for a better city that leaves no one behind, no matter what it takes. Thank you.
Thank you so much, Melissa. Next, we're going to hear from Melody Grant, a harm reduction outreach coordinator at Parkdale Queen West Community Health Center, as well as Calvin Henkel, who is coming to us from Regent Park Community Health Center. Melody and Calvin, please.
Hi, I'm here to stand witness to the abdominal treatment of folks who find themselves homeless and underhoused during this pandemic, and to testify to the success of collaborative multidisciplinary supports. This past year, I have professionally supported various folks in encampments across the city. I have seen increased violence and death as a result of forced displacement in communities which supported each other's growth and safety. Homes torn apart, relationships lost, and folks who formulated their own safety network pass away due to sudden decisions which increase the risk of overdose by isolation and displacement for supports they trusted. I have also seen how cross-sector supports can provide holistic approaches to housing, healthcare, and personal growth. The recovery hotel model addresses the immediate needs and rights of shelter and food while providing wraparound supports, which the traditional shelter and housing models have been lacking and have been called on to implement for decades. I have personally spent several months in the recovery hotel, working alongside nurses, doctors, peer support workers, harm reduction workers, city employees, and a variety of social support agency staff. Each team had unique offerings which addressed the individual person's well-being, including obtaining drug exemption to open a safer use space where people need it. For too long, we have gone back and forth about the financial strain and coordination challenges providing support requires. The recovery hotel shows us how determination and collaboration can address complex barriers folks face due to mistrust in the shelter system, which feels like a trap being bounced back and forth for years with minimal autonomy. As we enter a third wave of COVID, we have seen numbers continue to rise, disproportionately affecting folks who are homeless and cannot afford a recovery site with no more space. We must open a second location closer to the downtown core to prioritize the safety of the community. We also must use this model as a model to design further shelter and supportive housing options to offer empowerment to folks we're here to support.
Thank you, Melody. Calvin, please feel free to speak. Calvin, you're on mute.
Sorry. Okay. Hi, I'd like to thank you for your attention today. I want to contrast what homeless people experience compared to someone who's housed, right? So when we go home today, all of us, most of us, I'm sure, we can access heat, privacy, bathrooms, hand washing, laundry, cooking and food, bathing, showering, not to mention clean water to drink, and an address for deliveries. Now, when you're homeless, when you're sleeping outside, none of that is available to you unless you're, you know, unless you're able to park your tent in a park next to a washroom, a lot of that stuff is not going to be available to you. And then, you know, when COVID struck, a lot of the services that provide services to homeless people contracted. So they shrunk, and they made it, and it was very difficult for homeless people to access their regular kind of supports. And so, you know, so these are some of the problems that homeless people have been, you know, facing since COVID has started. One of the other difficulties is getting, you know, masks to protect themselves, and hand sanitizing kind of materials or resources. And that could include just like clean water and soap, and a place to wash up. So all of that has been very difficult in the past year. And so we are seeing, you know, outbreaks in various places amongst the homeless population. It has been very difficult for them to access kind of services if they're all shrunk, if they're not available to them as easily as they were before COVID. So today we're kind of asking, you know, this group here is asking that we open a second COVID recovery site. We had 2 of them before. It was working really well. We really need to have that returned to us. And then another thing that would be really helpful, well, there's 2 things. One is additional hotel shelter spaces where people have a little privacy. They have their own room, their own bathroom, food, and there are some supports in these places. But so definitely that's, you know, it's a good option for people instead of sleeping outside, or even in the shelter space or in the shelters that can, you know, that are still congregate spaces. So, and then the last thing, I guess, that I think that is very important is that we need to house people. Like I said earlier, we have access to all of these amenities when we go home, and I think we need to stop treating homeless people in Toronto that they don't deserve any adequate supports or resources to transition from homelessness to housing. And housing is so important, as I've just pointed out to you. And I'd like to thank you for your attention today.
Thank you so much, Calvin. I really appreciate that. Next, we're going to hear from Maria Scotton and Danny Ankle, who come to us from the Cecil Community Center. Maria is a peer worker and Danny Ankle is the executive director.
Good morning, everyone.
Oh, sorry, Danny, you seem to be muted.
I am. Sorry about that. I will say that again. Good morning, everyone. Thank you very much for inviting us to be part of this. When we first saw the letter, there was no hesitation on our part in signing on to it. Because it's interesting that the past year, the work that we've done really highlighted to us the need to be part of this. 3 words I want to open with: dignity, respect, and compassion. Those are the words that we use every day in the work that we do every single day. And I want to highlight to you a story that was in global news, April 16th, 2020. And the headline was, Toronto homeless man pleads for washroom, fresh water amid pandemic. And in that story, the man said, "Hi, hello to whomever cares and is in charge. My name is Jonas and I'm homeless. We're not all evil or bad. We're not all out to get nobody. And we're right now having a hard time trying to isolate." Another issue Jonas raised in the 75-second video that he placed online is the inability of the homeless to physically distance and self-isolate because, quite simply, he said he has no place to go. Susan Bender said earlier on in this presentation that we're not all in this together. I have said this over and over and over again. From the very beginning of this pandemic, it's been clear that we are not all in this together, and there's been a greater impact on certain individuals and certain groups. some people are actually falling through the cracks. Numerous studies show that vulnerable Canadians are falling through the cracks. For example, COVID-19 overwhelmed the long-term care facilities across the country, leaving Canadians shocked by the devastation. Cecil Community Centre needed to do something. We were all closed on March 15th, 2020. I remember that very well. And we were coming in every Monday thereafter to check mail, check the pipes, do different things like that. But we noticed a burgeoning homeless group around our building. We have a courtyard in the front and they were collecting there. The weather was changing and it was getting warmer and they had no water and no food. And so we started buying water and bringing water out to them every day. We partnered recently with Parkdale Queen West Community Health Centre to run 3 mobile pop-up COVID-19 testing sites. We wouldn't have been able to do that if we were closed. Our ability to support the stay-at-home order was highlighted when the provincial government issued the stay-at-home order and people had nowhere to go. Stay-at-home is really good if you have a home to stay at. And for people who didn't, Cecil Community Centre was the place that they stayed at during the day, which meant they were not circulating with other people. We opened on July the 20th, 2020 was the day we actually opened to the public. And in July, we saw 130 individuals come through our doors. That number increased every month and peaked in October with over 630 people coming through our doors. We haven't collated the stats in 2021, but I know that that number has increased. I'm just going to ask Maria to speak briefly on a project that we worked on that came out of our being open and working with the homeless population. Maria, if you want to speak quickly to the Breaking Barriers project.
Hi, thank you. Well, because of the increase in numbers of people that were coming in and especially the homeless community, the Cecil Community Center partnered with Christie Ossington Neighborhood Center to expand current project Breaking Barriers in order to address the needs of the homeless community that was coming by the center, to focus on areas like life management, health and wellness, income security and sustainable housing, which I'm finding particularly the sustainable housing is a bit difficult when there isn't much available. We can hire housing workers, but if there's no housing to put people in, then that's a bigger issue. But what Danny was saying is like Cecil Community Center didn't require all that much support from the government in order to remain open and to provide basic needs to people like such as washroom access, water, food, internet, just a warm space to go when it was cold out. If more places could do this, you know, that would help so much just to help people meet their basic needs of their everyday life when like they're already limited as it is to access these things, which shouldn't be a problem. Thank you.
So in closing, I simply want to reiterate the importance of community centres and community space being open for our homeless. We work in partnership with everybody on this call right now to provide help and support to people who ordinarily wouldn't even be thought about. And all of a sudden, you know, they're important because we're highlighting it. We will continue to fight for that. We will continue to remain open. And I'm encouraging other centres like Cecil Community Centre to step up as well and open your doors. Thank you.
Thank you so much, Danny and Maria. Next, we're going to hear from Brian Cleary, who is a former resident of Toronto's shelter system. Brian, please.
Hi there. I'm here to speak about the municipal government and in particular the SSHA, the Shelter Support and Housing Administration, and my experiences in the past 3 years as a client. There are some basic truths you need to know about a system that houses over 8,000 people a night that most people aren't aware of. 1, privacy is a weapon used against us to keep you from knowing what's going on there and to keep us from speaking out. The city statistics that they provide are not accurate and they are self-serving. We need better data here. 2, congregate settings are neither clean nor safe. They weren't safe before COVID, and they certainly weren't safe during COVID. We didn't have a mask mandate until September. We are told virtually nothing, and we were kept 18 inches apart on cots and told that was fine. We were kept 4 people to a room and told that was fine. None of this is fine. Even before COVID, congregate settings come with a much greater risk of personal assault or property loss. We need 1 person, 1 room, and an opt-in system. Congregate living provides support for some people, but it shouldn't be the default. The default should be 1 person, 1 room, and the safety and security that comes with that. Number 3, we need services and not programs. These individual client plans that we are promised do not happen. We are simply sheep counted for funding. There are far too many programs out there that simply refer you to other programs, but the actual services and support on the ground are non-existent. And what we're seeing on the ground is that while the big orgs are taking all the money, the folks that are actually helping are the smaller community orgs like Toronto Drop-In Network or Sanctuary that are volunteer run, mostly volunteer funded. The big orgs are like sponges soaking up funding and passing on referrals and not really doing much. We need more services and less programs. 4, our right to be heard and participate is meaningless in the system. We're not told anything, and we're not given any chance to give our input on how this works, despite being long-term residents of this system. We need meaningful participation. Client input must not only be considered, but drive SSHA policy going forward. And finally, we need a complaint system that works, because the currently one is broken and lets the very people you complain about investigate themselves. And then those results are turned over to the city with no chance to give evidence or appeal. COVID has only made all of this worse. We're dying within the system and we're dying without. The shelter system is not the magic bullet to pulling people out of encampments that the city makes you think it is. They lie about what's happening and they lie about what's going on every day. It's chances like this to speak up that we need clearly, and I'm privileged enough to be able to speak out. There are Indigenous folks dying out there every day in the parks that don't even have a voice in this, damn it. There are BIPOC folks that are far too afraid to speak out because of systemic oppression over years and years and years, and finally ended up in the bottom of the barrel and thinking no one listens because no one does. Please help us, please care, please support more events and organizations like this. Thank you.
Thank you so much, Brian. It's very powerful. I appreciate it. Next, we're going to hear from Angie, who is a former encampment resident. Angie, if you're present, please go ahead.
Hi, can you hear us?
Yes.
Hi.
Hello.
Hi, I'm Angie. I'm excited. I'm so glad to have the honor to speak here today about many things. I lived in the park for a little while, and then had the opportunity to go to a hotel, which where I think I caught COVID. The staff didn't care how people walked around, mask or no mask. They'd if there were other members around, they'd throw in, you may put your mask down or whatever, but 99% of the time they didn't give a shit. I guess basically it was up to us to take it upon ourselves to wear our mask. The 1 or 2 times that I guess that we wore it down, it shit happens. Now, I was sent to a hotel and then discharged from there and then sent to Peters. No, I was sent to Lakeshore, but that was just 2-way, like too hectic for me. So I asked my workers at Moss Park's injection site if they could please get me out of there. And of course, they're wonder workers, the best in the world. They got me out of there the exact same night and had me moved to Peter Street, 129 Peter Street, where people go to placed into different shelters. My boyfriend and I were in the program there, the bedding program. The bedding program is where it's like a long-term stay for a couple. You get a little tiny room, and that's just for both of you. You get 2 beds, which you put together, big enough for both of you.
1 minute.
I lost my husband there. He died there due to staff not doing their job properly. And the paramedics not doing their job properly. How does it take 23 minutes to reach from the ambulance,
Hospital.
At the hospital, right across from St. Mike's, 7 blocks to reach Peter Street? How does it take 23 minutes? They were called 3 times, stating that a man was had no pulse, and it was an emergency. 23 minutes they arrived to make a joke. Oh, it's only Oliver Smith.
Staff couldn't reverse overdoses either.
And when the fire department walked up to the paramedic, he said, it's really not a joking time. We've been working on him for 25 minutes, and we still haven't gotten a pulse. We think we lost him. And his whole demeanor changed. Now all of a sudden he wanted to be a super paramedic and start working on him like he was gonna all of a sudden get him back. If they would have done their job properly, my husband would be here today.
30 seconds.
But I just wish I could do something, and I am going to do something to help the next person, just in case it ever does happen. Thank you for listening. I appreciate it. But I'd like to speak to another news somebody from the news to listen to my story. If anybody would like to, if you're listening. Thank you. Bye.
Thank you so much, Angie, for sharing. And I'm deeply sorry for your loss, as are we all. Your husband should not have gotten. Thank you.
Thank you. You're welcome.
Sure. Next, we're going to hear from Lee Kern, who is the Rights Relations Coordinator at the Toronto Urban Native Ministry. Lee, please.
Ani Bojo. Good morning from Trinity Square. I've got a bunch of our community leaders here that are houseless and Indigenous, living on the land here since last year. And they're all sitting right in front of me here, making sure I don't miss a beat. It's a privilege to be here today from the territory of the Mississaugas of the Credit, the Michi-Sagig, the sovereign nation who continues to hold title and treaty over this territory, which includes a right of Indigenous people to live and camp and harvest freely on this territory, those belonging to the Anishinaabe Confederacy. So we acknowledge their sovereign right on this land, and we acknowledge all the Indigenous leaders that have continued to take care of each other all through the past year when the city abandoned them. We saw Indigenous people and houseless people, people who use drugs, survivors of colonialism and survivors of policies that would rather them dead. We saw these people take the means of survival into their own hands and support each other despite continued pressure from the Parks Department, city services, city workers such as Streets to Homes, and of course, Toronto Police Services, continuing to put increased pressure on those living in desperate conditions outside, just trying to stay alive and stay safe during this COVID-19 pandemic. Now, as we mark this 1-year anniversary, I would like to share a little bit about our experience here at Toronto Urban Native Ministry and Church of the Holy Trinity and our solidarity organizations such as Toronto Indigenous Harm Reduction. So 1 year ago, our drop-in center here served between 30 to 40 people a day, and people would come inside during the day and lay out in a pew to sleep and have a cup of hot coffee. Now, at this time last year, the whole city of Toronto shut down, and these people were neglected and forgotten about. Immediately, we saw that number go from 40 people a day to that first week of March 15th, seeing it go up to 150 people. We watched people that we knew, we watched the fat literally fall off their bodies, and starvation and hypothermia start to take over. People had no choice. As shelters, we lost beds in the initial period of the shutdown. People had no choice. There was literally no options. I would call Streets to Homes every day, trying to get a family that were living here, young Indigenous youth, a young man and a young pregnant woman who is 6 months pregnant, had been living here since even before the pandemic. I would call every day trying to get them housing. Continuously, I was told that the young pregnant woman would either have to go to a youth pregnancy shelter and be separated from her partner and be able to deliver the baby safely and then keep the baby, or she would have to choose her partner, go into a couple's shelter, and not be able to keep their child. For Indigenous peoples, these policies are racist. They are genocidal policies that continue to separate Indigenous people, separate families, and lead to child apprehension. That baby was born safely. She was born at a healthy birth weight. We were able to bring midwives down here to take care of the pregnant couple, check in on them every week and monitor the pregnancy, have ultrasounds literally outside. And yet still, the baby was apprehended as this family was pressured to be pushed off the land here, pushed into the shelter system, a shelter system that did not take care of them, but put them at greater risk of things like overdose and death, and ultimately led to their family being broken apart by the pressures of the system and the lack of supportive supports really for these families. So as we continue to feed people every day, our numbers again went from 40 people a day to 150 people. Instead of being open 5 days a week, we had to scale up to 6 days a week. And Toronto Urban Native Ministry, we had 3 staff, 2 full-time, 1 part-time. I have an immune disorder. We were able to continue to work all through the pandemic because I had boxes of masks. Because when I travel with an immune disorder, I have to wear a mask. So because of this, we were able to operate, but we had to provide shelter, water, bathrooms, housing support, all the basic necessities of life, triage people's healthcare. So here in Trinity Square, we organized the first accessible testing for houseless people for COVID-19 testing here in last May. And we provided water and all the basic necessities for life. Yet the city would turn out the electricity to Trinity Square. The city would close the bathrooms in Nathan Phillips Square and in front of City Hall, and the city would continually shut off water. These are genocidal policies. Last month, we added 18 names to the homeless memorial. The month before that, again, over 10 names. We continue to see our friends and community members die here on the streets while the city continues to criminalize people who live outside. I met with Kristen Wong Tam early on in the pandemic, and I told her the criminalization of people who are houseless, Indigenous, and living on the land needs to end. We are seeing a direct impact on people's lives. They are being sent to jails where there is active COVID. They're being pressured to go into congregate shelter settings where there are ongoing outbreaks of COVID. These options are not safe for people, but Indigenous people deserve autonomy. They are the stakeholders and rights bearers of this territory. We need to follow their leadership. Instead of a system that is top down and based on surveillance and policing, we need a system that is based on the actual lived experience and realities of people on the street, because they know what they need. They know what will keep them inside instead of having to live outside without access to bathrooms and running water. They know what they need, and they continue to be our leaders that we work with and support in their advocacy for their rights. We follow them and their autonomy and their self-determination. And we demand change now. The city needs to stop forcibly displacing Indigenous people, adding to the ongoing colonial legacy of genocide, of displacement of people of the land. We need to observe their rights, treat them with dignity, and follow them as they continue to exercise leadership, sovereignty, and self-determination as people of the land living on the land. So we need to stop the encampment clearings. We need to stop the over-policing of these peoples and see that talking about things like decriminalization of drugs and decriminalization of the tiny shelters and decriminalization of tenting, these are the basic things of people's survival. Kristen Wong Tam told me that these are two philosophical conversations, but they are not. The criminalization of people continues to set our policy as developers and big money continue to set policy directions for our cities, instead of people with lived experience, survivors of genocide, survivors of the Indian residential school system, Indigenous pregnant youth, showing us what they need and what their lives deserve as we stand with them to demand change now. Miigwech.
Miigwech, and thank you so much. That was very powerful. Next, we are going to hear from Alex Statham and Tina Eldridge, who are case managers and encampment outreach workers at West Neighborhood House.
Good morning, and thank you for having us. My name is Tina Eldridge. I'm a frontline worker at the meeting place with West Neighborhood House. A year ago, when the pandemic started, almost everything shut down. We were one of the only drop-ins in downtown Toronto that stayed open. Services closed, coffee shops closed, libraries closed, community centers closed. There was no place for folks to get food. There was no place for folks to use washrooms, shower, bathe, basic human rights and dignities. So at that point, we had to really reduce capacity of our drop-in to maintain physical distancing in the drop-in so we could still remain open. So we had to shift our efforts towards outreach. A lot of what we do here is we spend hours and hours every day on the phone with Central Intake, trying to get folks shelter beds, and there are no beds. Not that shelter beds are an option to housing. We need safe, affordable housing for people now. Call Central Intake over and over every day, only to close at 4 p.m. and people had nowhere to go. So we had to go out to them. So we're going out weekly to the encampments in the area, Trinity Bellwoods and Alexandra Park, bringing supplies, services, resources, and ourselves to the people who cannot come inside to access all of the supports they so desperately need.
And when we're doing this outreach, we're really noticing that we're meeting a lot of people that we hadn't maybe encountered before, who have moved into the encampments because they feel safer. staying there than in the shelter system, if they could even get a spot within a shelter. As Tina mentioned, I think we've both spent so much time trying to get spaces for folks because they want to get somewhere warm and there's just nothing available. And then we close, where do they go? They don't really have an option. They have to stay outside. And I think that's why the tiny shelters were so helpful in this very unfortunate situation that should not be occurring. As many who've spoken before us, housing should be a right. We need more affordable housing overall. But right now that's not available. And these tiny shelters offered a space for people to have dignity and privacy and warmth, and the option to stay outside. I mean, congregate settings, as others spoke of before us, they're not COVID safe. It's very challenging for them to be COVID safe. You know, it really needs to be one person to a room, and that's not available. You can put the barriers up, and that's great. But I mean, if you've got 100 people in a giant room, it's still a congregate setting. So personally, I would prefer to stay in a tiny shelter in a park. And I imagine most folks would. Shelters also impose restrictions against folks. They're not harm reduction. They don't offer harm reduction services. Folks might be barred or asked to leave if they are using, and they're abstinence based, and that can be challenging. But even before COVID, people didn't necessarily feel safe within the shelter system, as Brian spoke before. So I think it's really important that the city drops the legal pursuits against the tiny shelters. The tiny shelters are not the solution. No one's saying they are, but right now they are necessary to keep people safe. Thank you.
Thank you.
Thank you so much, Alex and Tina. Our final speaker today will be Dr. AJ Withers, who comes to us from the Shelter and Housing Justice Network. AJ, please.
Thanks, Diana. So I'm feeling a little bit shaken and really moved from what people have already said, especially from the words of Lee, Brian, and Angie. And now closing things off, I'm speaking about information, transparency, and data, which is a bit odd. But the thing about the importance of what I'm speaking about is that the city controls a lot of information, and without access to it, people can't make good decisions for themselves. We know, and what we've seen in the parks with people living in encampments, is that people need to be able to make their own decisions and can make good decisions for themselves, but without access to adequate data, that becomes really hard. And also for advocates and people in the community to be able to hold the city accountable, that's very difficult with the city controlling data and really limiting what people have access to. So we have a number of demands. The city needs to improve their data collection and methodology and dissemination to be accurate and expedient with its data in order for people to be able to mitigate harm and make decisions. And I won't go into the details, but they're listed there. And for the city's medical officer of health must include updates on trends and issues with respect to the shelter outbreaks. That's become a really key prescient issue for folks, especially the city. Shelter support and housing doesn't seem to be able to comprehend that a lot of people don't have phones or can't charge phones. As Lee said, the city cuts off power for people so they can't charge their phones, and yet the city's response is often for people to call back to central intake, or so when it makes contact tracing very difficult when people are transient and go from place to place. So without the city publishing even the names of where there are actual outbreaks, it's very difficult to trace what's going on if the city isn't releasing that information. And then thirdly, for the city's shelter support and housing administration to ensure a quality assurance mechanism with respect to infection control practices, and that all shelters funded by the city abide by these. There needs to be a high and consistent standard. So we're really heartened by vaccination, but there are going to still be outbreaks, and there needs to be a standard. And it's really shocking that this doesn't exist and hasn't been released publicly. There have been nearly 1,000 cases of COVID in the shelters that we've been made aware of, but believe that this is an underestimate. And the city continues to claim that these are the safest option for unhoused people. And this is in the absence of quality assurance and infection control practices. There has been some important progress recently. Shelter and Housing Justice Network and others advocacy has won. Toronto Public Health recently agreeing to publishing the actual names of distinct shelter sites where there are outbreaks, and the cumulative number of deaths of unhoused people who die from outbreaks in shelters. But the lives and safety of unhoused people, if it was prioritized, we wouldn't have to advocate for these basic things in the first place. This data should be readily available, as should the number of people who are turned away through central intake. That should be readily available on at least a weekly basis. This is the 1-year anniversary of the global pandemic. And when we have seen such a dramatic increase in homelessness, we call on the city and all levels of government to take immediate action. Thank you.
Thank you so much, AJ. This concludes our speakers for today, but we will be taking questions from the media if there are any. Feel free to speak up or to raise your hand. Okay, if there are no questions from the media, we'll hear again from Susan Bender, the manager of the Toronto Drop-In Network, with a conclusion. Thank you so much, everyone, for your time and for everybody who has watched today, and for media as well who are present. Thank you so much.
I'm so very proud and very moved to stand with all of you to demand that dignity, respect, compassion, and the realization of sovereign and human rights that you have all spoken to. And what does this actually look like? It looks like safe, respectful sheltering spaces, one person, one room, people having a voice in decision-making power within the system. It looks like stopping the violence and disruption of encampments that provide community spaces and connections that will actually get people through this pandemic, decriminalizing sovereign and survival acts. It looks like supporting staff so that they can do their best to help people survive this pandemic. It means stop people from having to become homeless, moratorium on evictions, and full rent relief. It means providing the funding for affordable housing and supportive housing now. You know, drop-ins and all of the services you're speaking from pivoted immediately when the pandemic happened, and they did what they needed to do and could do safely to support the people, support their community as they could. And we expect the same from all levels of government. Thank you so much.
Again, thank you to everyone today, and this concludes the press event. Thank you so much, and take care.